Hello there, I'm Irene Lozzi, psychologist and PhD student in neuroscience, psychological and psychiatric sciences, and movement sciences at the University of Verona, attending the second year of the doctorate course. My research project focuses on the role of negative expectations in patients with functional neurological disorder, or FND. But first of all, what is FND? Imagine that you have a perfectly healthy body with no obvious physical problem. However, suddenly you begin to experience strange and often very uncomfortable symptoms. You might have uncontrolled tremors, temporary paralysis, difficulty walking, or even temporarily lose your sight or hearing. That sounds really scary, right? Lo and behold, these are the kinds of symptoms that people with a functional neurological disorder may experience, leading to a great level of disability. The interesting thing is that although they seem like actual physical symptoms, when doctors do examinations and tests, they find no underlying medical causes. This means that there is no organic damage or problem in the nervous system or in other parts of the body. Thus, patients with FNDs are often accused of faking their symptoms or simply being stressed or depressed. In the past, much weight was given to the psychological component. However, there is evidence that it is not necessary to be stressed or to have experienced trauma to develop FND. Newer, more comprehensive models of the disease argue that these symptoms are the result of some sort of miscommunication between the brain and the body, which can cause abnormal motor, perceptual, or cognitive experiences. The aim of our research is to evaluate the role of negative expectations in these patients, as they may be a key element in explaining the disorder and in developing new and increasingly effective therapeutic interventions. To do this, we'll compare FND patients and healthy subjects using a very standard fear conditioning and extinction protocol, a technique used in psychology and neuroscience to study how the brain learns to associate fear or threat with certain stimuli. Under fear conditioning protocols, subjects are induced to fear a stimulus that is harmless per se by pairing it with a naturally aversive stimulus, for instance, an electrical shock. Extinction refers instead to a subsequent phase where the conditioned stimulus no longer signals the occurrence of the electrical shock and the fear learning is therefore removed. During the preliminary study, conducted on healthy subjects only, we recorded the skin conductance response, that is, the micro variation of sweating we have in presence of emotional stimuli or situations such as surprise or fear, and brain waves by electroencephalography. The results indicate that the protocol is effective in inducing negative expectations and suitable for recording the difference in physiological responses between situations that indicate threat, thus negative expectations, and neutral or safe situations, both in skin conductance responses and in EEG data. In short, the protocols appear suitable for testing our hypothesis on patients with FNDs. FNDs is a complex condition and can be very frustrating for patients, for their caregivers, and also for professionals taking care of them. So it is of pivotal importance to deepen our understanding of the disorder, which is still very limited. First, this research will provide scientific evidence in support of a more comprehensive model of the disorder. Moreover, identifying the influence of negative expectations on FND can lead to improved diagnosis and treatment strategies. Clinicians can use this knowledge to tailor therapies that address patients' beliefs and expectations, potentially enhancing the effectiveness of interventions. In addition, reducing the burden of FND on the healthcare systems by improving diagnostic accuracy and treatment outcomes can result in huge cost savings. When patients receive more targeted and effective care, it can potentially reduce hospitalization and the healthcare expenses. Finally, increased awareness of FND can contribute to a reduction in the stigma surrounding the disorder. A more informed and empathetic society can lead to greater support for those affected. Thanks for your attention, and if you would like to have more information about a functional neurological disorder, please visit neurosymptoms.org.